been through is a significant insult to his body. We're in the stage now of seeing the effects of that. Now, he's got some problems which I'll address, and he's not as well as he was yesterday. The reason for his deterioration is actually his chest. He's got obvious fluid collapse and decreased lung volume on that side, and fluid is building up as a result of that. He is passing urine. It could be infection. He is on antibiotics. But the chest, as I said yesterday, when you're really weak and gone through, the chest is the one thing that is the most serious event, because that's the one that often leads people to deteriorate and in fact die, because he's just too weak to cough. We can't move him. In terms of his stroke, hard to assess him. He's quite sleepy today. He is still moving his right side. The left side, he's got a bit of flicker on his toe, but I've got no other movement. His speech is affected, but as I said yesterday, he's a left-hander, and a right-sided stroke can affect the speech in those people. The other problem is his kidneys. Now, Tyrone, when you asked about that, he is passing urine on furosemide. His creatinine has gone up to 200 and his urea is 11.
Right.
But I honestly don't think the kidneys is the limiting factor here. I think what we're seeing with Mr. Lamb, unfortunately, is a deterioration. And I have to be honest with you as a family, is I don't think we can fix Mr. Lamb. And my advice medically is that we should make sure that he is comfortable. We will continue the antibiotics, continue giving him oxygen, fluids and feeds. But as I mentioned yesterday, escalating advanced and invasive procedures are not without their risk, and in fact cause suffering. In terms of dialysis, he does not need dialysis today. I don't think we should reinstitute dialysis, and the cardiologists agree with that. And the reason for that is that the kidneys, I don't think, is the reason for his deterioration. Looking at him today in his X-ray, it's his lungs, and I think that's a combination of his age, his frailty, the insult to his body, and the fact that he's had a stroke and can't cough.
So for the lungs, has he got a pleural effusion or collapsed lungs?
I think he's got collapse. He's got some fluid from his heart, because his heart's not, he's got some significant left ventricular dysfunction as well. I don't think draining the fluids will improve it. He's just not able to cough. He's not able to breathe adequately. So while I can do things, I don't think it's going to actually improve him.
Right, like so the chest drainage is not feasible.
Everything's feasible, but I don't think it's the right thing to do. Chest drains are risky procedures. They're painful procedures. I don't think that's the reason that he's deteriorated. I think what we're seeing, the fluids building up as a reflection of his underlying multi-system failure that he's had since this event.
Mm-hmm. All right.
He's had a stroke. He's had a major ECMO. I mean, I do ECMO in my other job is in the tertiary hospital. 92-year-olds generally are not offered it. It was done as an emergency, but it puts immense stress on his body. His kidney failure is just reflecting, but his kidneys were already impaired prior to this. He is passing urine. I can dialyse him, but it's not going to change what's happening. He's just deteriorating it slowly because of what's happened to him. He's given antibiotics, he's been given fluids, we've given him dialysis, we've put him through a lot, and he just has not improved.
Right.
So I think really his care should be more of a palliative and comfort measure should be what care we should be providing.
So how long have we got?
Oh, look, I don't know. He's certainly worse, I think, today than he was yesterday, in terms that he's a lot drowsier. His oxygen requirements have gone up. I have started him on a little bit of subcut morphine just to help with breathing. I've increased his heart failure medications to try to get the fluid off. I've increased his diuretics. But he's just, if you look at his lungs, he's just not breathing. They're consolidated, they're collapsed, they've got fluid. And we see that, unfortunately, in people who are at the end of their life. Ends up what's happening.
Okay. And the LASIK doing any help?
He's passing urine. He's between anywhere between 40 and 70 mils an hour. which for someone of his body, age and weight is good. I don't think he's fluid overloaded. I've got him fluid restricted. He's on feed-wise on a renal. He's on a sorry about that. I was just talking medically here. He's on a renal feed, so we reduce the fluid, give him the calories. But he's just a frail. He's very frail, and I just don't think if you can't. Normally, what we do is, as you would be aware, we get patients up out of bed, we get them walking. The physios get them the cough. He is so weak that he can't do any of that. And I think that's a reflection of what's happened to him.
All right. Okay, so his daughter, my wife, is going to fly up tonight.
Yep.
And stay there until the weekend. I'll come up on Friday.
Yep. Look, he's significantly worse than yesterday in many ways. I mean, the good thing is he does wake when his family ask him to, but he doesn't stay awake for long. So look, I can't give you a time, but I do think that my treatment for him really has got to make sure that he's comfortable.
Okay.
Then that would be to me my biggest priority. I just don't want him to suffer.
Okay. All right. Yeah. So I'll leave it to other people to ask questions. I think.
Yeah. No, that's fine. Yeah. So what the cardiologists have put in their notes, and I agree with them, is to take the VAS cath out of his neck. I'll leave the cannula in his neck because basically it means that we can give him drugs and stuff without having to put many cannulas in him. So that's part of his comfort. And we'll continue obviously to support him. We'll get the physio still working on him. We'll still keep the antibiotics going. We'll still feed him. But I just think I've got to make sure that he's not distressed and make him even more distressed.
Okay.
Thanks for that.
All right. Thank you.
Now you've just listened to us, a lot of medical talk, I'm sorry, but that's probably the best way. But what I was basically saying is that Mr. Lamb, I think, is dying. And I think what's happened is he, as you see, he's just so weak and frail, he's just not able to cough up. And generally it's pneumonia or lung issues that is the reason that people end up dying. Despite physio, despite oxygen, despite the high flow nasal prongs which drives air in, he's just hasn't got the reserve to help. And when we are aiming to fix people, we really need their body to be able to help. Antibiotics need a good immune system. The oxygen and so forth need muscles, and he just hasn't got that strength. He's obviously a very strong man to have actually,
gone this far.
gotten this far. I mean,
This
most
is
people
one
wouldn't do it.
collapsed lung.
Yeah, both lungs are. I'll show you the X-ray if you want. And if you want,
There's
I'll
no
let you
reason.
take a photo and you can send the X-ray to Tuan if you want to.
Would you like that, Anton?
Yeah. Okay. Please.
Yeah, I'll do the chest X-ray for you. And you'll see what I mean with that. So really, what we'll be doing, we'll look after him, and with the family to be around him is what I would actively encourage, because I think that's the best I see him is when we're around him.
Is it okay, Doctor, ask my brother-in-law to explain to other members?
Yes,
That is
absolutely.
not very good in English. And then, would you like to give everyone just a quick update in Vietnamese?
Okay. So ông nói là cái tình trạng của ba hiện bây giờ là cái quan trọng nhất ảnh hưởng cái sức khỏe của ba là cái phổi nó bị nhiễm trùng, rồi cái phổi nó bị lép qua như có nước, thì cái đó là cái điểm quan trọng nó ảnh hưởng tới tính mạng. Ông có hỏi ông là ông có thể đẩy ống vô lèo lấy nước, thì ông nói là cái đó cũng không có làm gì được hết, tại vì cái phổi giờ nó quá yếu rồi. Cái thận thì yếu hơn chút, nhưng mà ông nói là cái thận không phải là cái điểm nguy hiểm bây giờ, mà cái phổi là cái điểm nguy hiểm nhất. Thì bây giờ là ông chỉ là cho thuốc để cho ba đừng có bị đau. Không có khi nào mà cái thường nếu mà ba khó thở và ba thở hổn hển rồi đó thì nó sẽ cho thuốc morphine. Thường thường cái thuốc đó vô thì nó làm cho mình cảm thấy được có khó thở nhé. Thì nó vẫn tiếp tục nó cho ba đồ ăn vô trong cái bụng, rồi cho oxygen, cho đầy đủ hết trơn, rồi có physio vật lý trị liệu lại làm cho cái phổi ba đỡ hơn. Nhưng mà thì nó chỉ là giúp đỡ vậy thôi, nhưng mà Nó nói là có gia đình tới lui ở cái cạnh bên ba, thì lúc đó nó thấy ba đỡ hơn nhiều, thì phải cố gắng luôn lúc nào cũng có người ở với ba. Thì câu hỏi ông là còn bao lâu nữa thì ông có trả lời được nhé. Bây giờ chỉ là ông chỉ tiếp tục ông cho thuốc rồi cho oxy cho ba để được không có bị đau chứ không có bị khó thở thôi. Ok, các em có hỏi gì không?
Thanks, I appreciate that.
Thank you.
Any questions?
Thì thường đó là khúc chót là cái tiếng Anh nó có nói là như là cái pneumo là cái viêm phổi đó, là cái old man's best friend, là nó làm cho mình đi lúc cuối cùng. Cho cái phổi là cái điểm ảnh hưởng nhiều nhất. Ok, Phúc còn gì đâu Phúc?
We will continue to, obviously to care for Mr. Lamb, and we'll look after him. As I said, we will continue to support with oxygen feeding, but comfort is our major priority for him.
Thì nó nói bây giờ bác sĩ với mấy người làm việc ở đây, mấy người y tá nó chỉ có làm cho bà feel comfortable thôi, cho thoải mái, cho đừng có đau đớn thôi.
Thì đừng có bị đau, đừng có bị khó thở nhé, đừng có bị ngọt nha. Thì nó để oxy vô cho đừng bị ngọt nha. Rồi khi mà cảm thấy hơi ngọt thì cái thuốc morphine nó cũng làm cho nó đỡ hơn cái cảm giác đó nha. Có đau thì nó chích morphine thêm, thì khi mà có morphine càng nhiều thì ba hơi vẻ vang hơn.
Với bác sĩ có nói là trong lúc này á, thì gia đình gắng spend a lot of time with that, you know, thì ở bên cạnh ba đó càng nhiều càng tốt đó.
We'll facilitate obviously the family first.
Yeah, so from a nursing perspective, you guys are welcome to stay now throughout this period and also throughout the night if you want. We probably won't have everyone here overnight just because it will disrupt the other patients. If anything was to change with his condition and we needed to call everyone in overnight, of course that's fine. But in terms of staying overnight, at the moment, probably just a couple of you. If you want, there's no pressure.
Yeah, we will stay.
It's clear how important he is to everybody. I mean, it's just amazing.
And
To
the
the
family.
family.
And the family
Yeah,
for a long time now. So
it's amazing to see.
yeah, it's been beautiful.
Thì bác sĩ có nói là không biết bà sống được bao lâu trong thời gian này, thì mình ở cạnh ba tốt nhất. Thì tối nay con con ngủ ở đây, còn other nights, nếu mà ai muốn ngủ được á, thì ở lại với ba. That doesn't happen.
Ok, thì Nhung khi mà tới airport Nhung sẽ kêu Uber chạy thẳng lại bệnh viện luôn.
Okay, yeah, we'll look up that.
And look, if you've got any concerns, please, the message up there, raise them. If you're worried there's any comfort or you're wondering what we're doing, and so always please raise that with you. And we'll care for you.
Cố có hỏi gì không Cố?
Nếu mà trường hợp ba nằm đêm mai như vậy đó, mình để cho ba nghe niệm Phật này nọ có được không?
Giờ không nghe đâu Phúc.
Nghe không được
Dạ
đâu.
không nghe.
This is my auntie, but my dad and my sister. She's asked whether she can give dad some meditation video or audio. Could
Absolutely.
Yeah, okay, we should probably put it next to
Yeah,
his
absolutely.
left ear. Yeah,
No,
thank you.
absolutely.
Yeah, fantastic.
That
Thank
would
You
be
can
very
play
good.
music, whatever you
Yeah.
want. Can't burn anything. But we can
No,
play
anything.
music, that's
Music.
fine.
Okay, yeah.
Singing.
Oils, anything. Yeah.
Like on loudspeakers,
Nếu mà
okay?
nghe
Yeah, that's
gì
fine.
mà
We can pull the door.
Yeah.
Cái đó cũng không biết đâu, tại vì ba nãy giờ
Sạc một phim là không nghe.
chích thuốc mê vô cho nên
Okay, put a headphone, doesn't matter, he hear. Can put a
Thì
headphone.
để xuống cái đệm.
Để nó để loudspeaker được, nói không sao.
No, không cần loudspeaker, headphone.
Make it uncomfortable for him.
No,
Cái còn
headphone
một
is something.
cái điểm quan trọng nha,
I'm not
là
one of them.
bây giờ bác sĩ chỉ có làm cho ba là comfortable, cũng như được đau đớn để cho ba đừng có quên tay quên chân, tại không biết gia đình có thấy không, tại vì ba nó cột cái tay ba lại á, nếu mà ba tỉnh vậy á là ba mở mấy cọng dây ra. I just explained that you pull out the tube, just at the moment all you do is just make sure he's comfortable.
Yeah, but we're going to
Yeah.
continue to support the citizens.
Yeah, yeah, but
You're just fine. There's no more
Mà trường hợp của ba bây giờ đó coi như là ba chỉ bị phổi thôi chứ ba không có bị stroke, tay chân ba cử động được đó không?
Đâu, tay trái của bà không có cử động
Như
được,
stroke
tay
luôn.
trái bà cử động được.
Vì
À,
bữa
hiện
trước
tại bây giờ bác sĩ không có trị cho nó chỉ có để chỉ cho thuốc tặng cho ba
Calm down.
là không có cách để chỉ ba từ từ á, thì ba
Sẽ
sẽ
đi.
qua đời ha. Cho nên gia đình gán lại thăm ba đi. Okay.
Bây giờ nói bây giờ bác sĩ là người ta không có điều trị ba được nữa rồi. Bây giờ the best là họ can do á, là chỉ làm cho ba làm sao ba thoải mái.
Yeah.
Bây giờ anh em mình nó mặc dù mình buồn nhưng mà đừng có khóc nhiều quá, mình cứ cầu nguyện cho ba trong lúc này.
Đúng đúng
Ha.
đúng, tốt đồng ý.
Thank you, Tanya.
Thank you very much for coming. Thanks one very much.
Thank you so much. Thank you. I really appreciate it.